All right, we will call this meeting of the Community Development Committee to order. Thanks, everybody, for attending. It's really nice to be back in person again and to see real people, and eventually we'll see them through their masks, but for the moment, it's great to have this physical connection to each other and to have you all here, so it's greatly appreciated. I'm John Strand, your chair, and today's going to be a really informative discussion. We'll do introductions shortly, but I just want you all to know that for today's sake, it's informal. So don't worry about making sure you get my attention to speak or ask a question or engage. If I need to rein you in, I will, but I'm not worrying about that. So give yourself just a comfort level of interacting with each other conversationally and casually, and extract from our presenters the most pertinent information you can, so that you've capitalized on this moment to learn as much as you can from the presenters. So again, I'm John Strand, your chair. We'll start over there with John Gunkelman and run around and do introductions. We have at least one new face here. So we'll start with John.
John Gunkelman, Fargo Planning Commission.
Sam McDonald, Member at Large.
Robin Nelson, School Board Representative. It's not working.
There you go.
Linda Klebe, Member at Large.
After 20 years, we got to get these red, green lights figured out.
Technology.
Good afternoon. I'm Mike Brethinger. I'm the Assistant City Administrator, City of Fargo.
Thomas Silm with United Way of Cass Clay.
Tim Mahoney, Mayor of Fargo. Ken Enixon, Member at Large.
Chris Brungart, Fargo Housing Authority.
Welcome, Chris. You're replacing Matthew Pike.
I am.
And you had been, and before that it was Lynn Fundings, Lynn. And you've been assigned by the Housing Authority to work with us because you're the person with the expertise that we're looking for.
Oh, great. I'm happy to be here. We also have our Executive Director, Jill Elliott's attending here today also.
We do. So let's continue on. Is there anybody who has any changes to the agenda? If not, the agenda will go forward as planned. And let's have a motion to approve the December minutes, if somebody would be so kind.
So moved.
Sam moves. Is there a second?
Second.
Second, John Gunkelman. Any comments or changes for the corrections for the minutes? If not, we'll just call for a voice vote. All in favor say aye.
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 Opposed, nay. The minutes stand. At this point in time, we have a designated agenda item calling for public comment. If anybody in the audience has shown up to comment or to speak to us or address us, this is your moment. And Nicole, there's nobody virtually, I'm guessing? Okay, we'll go on to our next item. Nicole Crutchfield has been working on this meeting for some time, and the concept of this meeting and what we're going to be doing with this meeting. And as we go forward, you'll see that we're really kind of redirecting or refocusing the Community Development Committee, especially right now, on housing topics. That's really going to be our bailiwick. We have our other arenas that we're active in, but housing and the spectrum and the continuum of housing and all of that, the needs, the gaps, the barriers, the pluses and the minuses. So this is our day to really have a really good diving in, drilling down deep discussion about housing. And Nicole and her team have brought together all of the experts to guide us. So Nicole, I'll turn it over to you.
Great. Thank you, Commissioner Strand. And we're really excited about this meeting today, and we're really excited to be in person. It's been quite some time since we've been able to start having board meetings in person. And so there's definitely some enthusiasm with that. During this last year in 2020, planning staff, as you know, has been spending a good 50 to 75% of our time working with these folks here in the audience, as well as many other partners in our community, as we hear and figure out how to respond in regards to COVID. And as we know with COVID and the response to the pandemic, it's affected many people in our community, but in particularly the question of housing and housing demand, and those most vulnerable for losing housing has been top of mind, top of priority for our department. And so as Thomas and many people here, Thomas with United Way and many people in our audience, as well as members will know that as we are going into the first stages of the pandemic response, there were Saturday, Sunday evening calls, Friday afternoon calls. It's just round the clock as we're trying to figure out what is happening, what's going on. And at the planning department staff, we stay pretty high level with community development block grant. We're administrating grants. We're hearing firsthand from our partners, but those partner conversations might happen quarterly at best. And but in the height of the pandemic and throughout 2020, those calls were happening 3 or 4 times a week, as well as developing deeper and deeper into the problems at large. As you heard last night at City Commission, we're coming into some unprecedented, hopefully, funding resources. And so we want to look to those as we think about future funding, as well as hear firsthand from our experts who are on the ground, on the front lines, if you will, of responding to those in need of housing and trying to get people housed. And we had the luxury of working with some folks in our community as we apply for emergency service grant dollars, and as well as many other grants. I think we're on our 3rd or 4th round of grant administrations. As you know, at the last part of last year, as part of Red River Task Force funds, we administered over $3 million in direct payment assistance, thanks to the partners in our room and other partners in our community. We've also administered over $750,000, probably closer to $1 million in emergency sheltering, quarantine and isolation support, and other housing needs in response to COVID. On a normal year, Tia and her team administer maybe 400,000. And so it's been quite a year. And I will say nothing has been as emotionally and as engaging charge in my 25-year career than this last year. And we're working with the partners that we've invited here today. There's many other partners. Anybody that's gone to a FM Homeless Coalition meeting knows there's over hundreds of partners that work in this field every day. And but we've today wanted to highlight some of the programs and activities that we're collaborating with, and also for you to hear firsthand on some of the nuances and details and their vision as vision leaders in our community as they try to address housing needs in our community and compassionate care in our community as we work with members. So with that, I'll start with, as you know, if you read the memo, we have kind of 3 at-large questions that we've asked each of our guests to talk to. I think each of these guests in their own right could probably speak for an hour and a half. And so we're going to try to keep it a little tight. And we want you to kind of see the breadth of their thinking, as well as the breadth of the issues that keep them up at night, and to steal from Commissioner Strand's question, if you had $1 million or if you had a magic wand, what do you see? So we went ahead and stole that question from Commissioner Strand to get to the heart of the matter. Because I think what you're going to start to find out as a next phase of discussions, not maybe today, but next phase of discussions, is we do have some fundamental philosophical differences in our community on how to respond to housing and how to respond to care for people needing shelter. There's a vast array of differences in population needs, and it's not a one-size-fits-all. In discussion with Rob Swires with New Life Center yesterday, every day I have an aha moment, and one of those aha moments was we can't talk about single unsheltered women in the same breath as single unsheltered men and assume those needs are the same. We are even talking about census counts in the summer versus census counts in the winter. And I'll just say one detail that I've learned in the last 30 days is when you're talking to Pastor Sue, their counts in the summer are higher because if we think about women feeling maybe more able to escape a dangerous situation or not worry about cold or winter, they're going to maybe be, again, assuming, not everybody's the same, but this assumption that their availability or ability to get to shelter or to commune around the community is going to be different in the warmer months. So their census counts actually go up in the summer. And so she was saying this story to me in the need to get rid of the concept of winter overflow. Instead, just call it overflow, not a temporal. When talking with Rob, he was saying, well, his population, again, just a universal blanket statement, some of those populations are going to feel better, safer at, they might camp or live outside a little bit in warmer climates, but maybe, when the temperatures get to the worst is when they see their census count grow. So it's not each shelter is even functioning with the same, kind of assumptions. And so we have to be really mindful of that when we're looking at policies and tools. And so this is just one little detail example of as we get into the deep dive. And so with that, I want to start with Lisa and Dan. I'm not sure who's going to speak first, but Lisa. And Lisa Rutvold and I and Dan Madler and Tia have been undergoing an activity that we're kicking off in earnest this week or this month with a housing housing study, kind of a micro study, as we look in our core neighborhood property boundaries and our downtown boundaries on looking at a deeper dive on what those gaps are for social service or for support services and housing. And coming from the landlord perspective as BSI or Beyond Shelter, it's really fascinating to hear what is going in their mind as they undertake evaluation of the Graver and other facilities as they see a change in their needs. And so with that, I'll introduce Lisa and Dan.
And excuse me just one second, is that Mark Puppy in the audience? No, okay, it is Mark. You can come up and grab your seat. He's with the Home Builders Association, so welcome up to the, and is there a DCP rep here? I just saw you walk in, Mark, and I thought it was
She
you.
was
Well,
unable
actually,
to attend today.
Laura, do you want to sit up here? Yeah, I just realized Laura is with the DCP, and she's in our audience, so you're more than welcome.
And
to-
I'm sorry to introduce, you folks, Mark, and if you could introduce yourself briefly, then we'll continue on, Nicole.
Yeah, thank you for that.
Mark Puppy with the Home Builders Association. Push the green button. If it's green, it's better. Yeah, you want to be on green. Irish.
Puppy with the Home Builders Association.
And I'm Laura Larson. I'm with the Downtown Community Partnership.
Great, thank you. Now we have a full committee, and Nicole, back to you and pass the baton.
Hi, I'm Lisa Rutvold with Beyond Shelter. Dan Madler, our executive director. We are a nonprofit charitable organization that's been operating in Fargo for over 20 years. Our mission is to change lives and create communities by developing and sustaining housing for those most in need. And so our primary focus is senior housing, housing for working families, and then special needs. And as a part of the special needs, we've participated in any number of developments for people coming out of homelessness or at risk of homelessness. Here in Fargo, we built the Cooper House and partnered with the Fargo Housing Authority for property management and Dakota Foundation for services. That building houses individuals who are coming out of long-term homelessness, chronic homelessness, so they're just kind of a pretty needy group of people, and we're fortunate to be able to staff that building 24/7. We also have the Graver. The Graver is downtown here. I'm sure a lot of you are familiar with that building. It has been affordable housing for many, many years. Beyond Shelter participated with Fargo Housing back about 17 years ago to redevelop or acquire and rehab using low-income housing tax credits. It is occupied by extremely low-income households. The average income, $9,736 a year. And so just a group that really doesn't have many resources to be a safety net for them. Also around town, Beyond Shelters worked on the Sisters Path project. We partnered with Churches United for the Homeless on their Bright Sky Apartments, with YWCA on their Grace Garden building that opened a couple years ago, and projects in both Bismarck and Grand Forks for people who are coming out of homelessness. Let's see. So currently, Beyond Shelter has 460 affordable homes in Fargo, 786 around the state. Vacancy rate for our BSI properties in Fargo is about 2.5%. It's about 2.2 in senior housing. And in our Graver building, it's about 13. And it was at 25 for a while. And so we're trending better, but we're kind of stagnant right now. So in looking to the questions that Nicole put to us for today's meeting, let's see, so as a mission-driven developer, owner, and operator of housing for people coming out of homelessness or at risk of homelessness, the greatest gaps that we see are the availability of rental subsidies. Obviously, if you earn, $9,000 a year, you're going to need some help with rent. With service availability for tenants, who can we call? We have situations over there where, we know things are going badly for one of our tenants, but we don't know what to do about it or who to call or how we can get help for them because we want them to be successful. And so that is a need that we're looking for a resource. The last one I'll talk about is just operating funds. The cost of operating housing for this kind of high need population ends up being a lot higher than housing, for seniors, for instance. Things that are higher. Almost every one of these buildings that houses people coming out of homelessness has had a fire. And so our insurance at the Graver, for instance, has gone from about $25,000 a year to about $60,000 a year to about $72,000 a year. And that's because we had a fire and we had a claim. And that's happening in, many of these buildings. That's a cost we don't have a lot of control over, and it's out of the ordinary. Other things, we've had to hire security in the building, which is another $70,000 a year. Let's see, we have had some very costly turns when people move out and leave really significant damages, and we have to, spend $5,000, $6,000, $7,000 to get it ready to re-rent. So landlord mitigation, I guess, is something that we find it's here, but it's underfunded and it is a gap. So Beyond Shelter's ultimate vision would be to partner with committed local service providers to operate supportive housing that we can build. We're good at creating units. We're good at building things. We're not service providers. We don't want to be service providers. There are a lot of good service providers in the community. We would just like to partner with them. And so that, I guess, part of the magic wand question is when we're doing a project with low-income housing tax credits, which is the primary tool that we use to do new development, our investors want long-term commitments. And so they really want a service provider who can make a 15-year commitment to the project. And that's the real challenge for service providers who are operating on, a 2-year budget cycle or, don't know what's going to impact their ability to fund their programs for 15 years. So that has been a challenge that we've had to kind of try and navigate. And so I feel like if services were adequately funded and were able to partner with developers like us, that would be just a win-win-win for tenants, the service providers, and for us. And finally, some ideas of what the city can do to support the work that we're doing. You know, continue to direct public funds, CDBG, home. Who knows what will come with some of the COVID money into affordable housing developments. You know, sometimes finding a site, particularly when we were looking at downtown, can be very challenging. So any assistance that might help us acquire a site. Providing pilots is really essential just to help keep operating costs down, and it also makes us more competitive when we are competing for funding. Guiding public health resources to supportive housing, fostering trust and communication between law enforcement and permanent supporting housing operators and tenants, supporting local service providers, and an emergency response for service providers, and then also supporting landlord mitigation. So in closing, we've been doing this for 22 years. We have to compete in the marketplace as a developer. We have to attract investors. We have to win funding through competitive grants. We have to maintain occupancy, maintain revenue, maintain particular debt service coverage ratios for lenders and investors, and put the well-being of our tenants, you know, first and foremost. And it's a really challenging juggling act sometimes. And so we feel like we really, really want to be part of the solution. We want to be part of, you know, meeting the needs of these folks, but just acknowledging that those are some of the challenges that we're facing.
And I guess the only thing I have to add, kind of what Lisa kind of summarized, is kind of really excited to be participating in and maybe starting this conversation. I know this conversation has happened in the past, and maybe it's re-engaging the conversation by taking a look at what lessons have been learned in the past so that we can move forward and maybe make improvements and some changes, because the need, as you'll hear from some of the providers that deal with the emergency and the day-to-day and transitional, is there. And I think once we commissioned this study to kind of take a look at some of the demographics, you know, additional permanent supportive housing is needed in the community of Fargo. So the question, you know, and some of the challenges that Lisa mentioned is how do you put together a project that can be successfully? It's easier to get it financed and built, but the operational phase of the property is the most challenging. And it takes several stakeholders that have the deep capacity and willingness to be there, not only the housing piece, the affordability piece, but the supportive service piece. So I'm looking forward to basically maybe taking the conversation and continuing the conversation to the next level, so that when a new permanent supportive housing project is conceived and moving forward here in the community of Fargo, we can utilize some of the conversation that is starting today and that will continue to basically put a project in service that'll definitely serve the community of Fargo and be an asset to the community of Fargo, as well as serving the tenants' needs. So with that, we look forward to continuing the conversation, would answer any questions that you may have at this time, and or turn it over to the next folks that are going to comment on some of the other issues.
And for the sake of Laura and Mark, who joined us, this is very informal. So if anybody, this is just chime in. If you have comments or questions for Dan and Lisa while they're still at the podium. I do have one question. When you mention insurance, just for my sake, is that a private insurer, or do you go through North Dakota Insurance Reserve Fund?
No, we go through private insurance.
Okay,
Yeah.
that's better.
Our investors have really particular insurance requirements. And so we've looked at the North Dakota Fund before, but they're unable to meet the particulars. So we haven't been able to go that way.
Okay. Who else has feedback for them or questions?
I have a question about
Are the fires being set by people?
Fires, we have people who fall asleep while they're smoking. We had a cigarette that landed in somebody's laundry basket. What are some of the other?
Sometimes they're cooking and they leave
Yeah.
and they forgot that they were cooking something on the stovetop. Yeah.
Yeah,
it's
just
a-
kind of things like that. No, I don't think we've had any arsonists or anything, but just accidental fires. But
These buildings are all sprinklered.
yeah,
And that's, so a small fire truck, fire department comes, $3,000 worth of damage in the unit. Water damage, $500,000
the water,
trickles down.
everything below it, and yeah. So that's where a lot of the damage does come from.
Curious if you can comment on questions or the supportive service aspect, because obviously different people need different things. You want to make sure it's person-centered. Absolutely understand that. But who does the case management or supportive services at the Graver? I think you'd mentioned Dakota Foundation at Cooper House does, or is supposed to.
Yeah, so the Graver is not actually supportive housing.
Okay, so it's just, all right.
You know, many of our tenants could use supportive housing, but there are not built-in supports in that building. So they're coming in, some of them have case managers, and then those folks are checking in with them. Some of them could use a case manager, and some of them, are declining to take help. So yeah, it's kind of a mishmash over there.
Can I jump in and just comment? I know Heather, Leah from the Gladys, right? I know Heather at the Graver calls a lot when they're having issues, and if it's somebody that we've placed there or that we have a good relationship with, our mobile outreach team will go over and try to connect with them and do what they can to.
And sometimes we have, our Heather is our property manager. She's fantastic, and really knows the tenants and really cares about the tenants. And sometimes she just sees, she sees things going in a direction that's not good. And she anticipates, okay, if something doesn't happen, this person's going to end up drinking himself into the ER this weekend, or we have some pretty vulnerable people who live there, and oftentimes they are exploited, by other folks who live on the streets, and sometimes they're stolen from. They get in to apartments. They'll get their key fob, they'll come and go, and then the behaviors of the guests really put the tenant at risk, and others in the building as well, people who aren't supposed to be there getting in. And we could dive way deeper into that, but we won't today.
How does your programming intersect with transit, public transit?
Well, I guess we like to try and build in locations where they're on a transit route. And so very few of the tenants at the Graver, or either Cooper or Graver, have cars. Most of them do rely on public transit. Yeah. But if we want to be on those bus routes, just so people can navigate their way around town.
Anybody else?
Should you be able to afford service providers for your buildings, does our community have enough people to staff positions like that?
That's a
people that are
great
trained?
question, and one we're hoping to also find an answer to. Our sense is many of the service providers are just really overtaxed. And so in my uneducated service world mind, it seems like, more bodies, more people, more boots on the ground would be helpful.
And then that goes to the magic question, or the $1 million, the wand is, you know, you can identify there's a need for support services, but then there's also a funding. Where's that funding going to come from and be paid for, et cetera? The property itself is just set up to collect rents to pay for the operations of the property itself. It isn't set up to fund supportive services. And so, you know, right now we're working with the state legislature to get adequate funding for the Cooper House, for we can have 24-hour coverage and maintain supportive services and hopefully enhance supportive services. And so far that's tracking pretty good. But a property like the Graver was never set up as a permanent supportive housing project. It's just being occupied by folks that may have some high needs. And with COVID, a lot of the folks, let's just say from Southeast Human Service Center, a lot of them were said you can't go to the building anymore. So we also basically had some of that COVID challenges, but now they're re-engaging and they're now coming to the building. But those costs are all borne by, you know, the Department of Human Service Center. And so funding of adequate supportive services, I think, is the challenge for many of the providers.
Yeah, because we're good at housing and they're good at services. And so, you know, let's all do what we're good at, right?
Robin, did you want to chime in there?
That's what happens when I whisper something in John's ear. I was on a Chamber Public Policy Committee meeting this morning, and there's over $1 billion that the state does not know how to spend, and coming in from some of these federal funds. So I assume that's what you're talking about when you're working with the legislature?
Not on the COVID dollars, no. This is just a direct line item budget within the Department of Human Services that has been in place for the Cooper House since we placed that building in service with the Fargo Housing Authority back in 2010. And then this year it was basically scheduled to be cut in half, inadequately funded. So the Fargo Housing Authority, Jill and Chris and myself and other supportive housing, our developers, Grand Forks and Fargo have been working and working really hard to get that funding restored and actually enhanced, and so far so good. It's tracking in the right direction.
Do you have the number of that bill offhand?
House Bill 1012.
Okay.
It's in conference committee right now.
Okay.
And we've been trying to track some of the COVID money coming into the state. And I know Dan has been trying to keep track of where the legislature is putting it in the budget, and that's become challenging.
There are segments like for school funding to address homeless students. So I'm sure there are some dollars that are tagged and flagged for homeless services and operations.
Yeah, I think the city is going to get some home funds for homeless.
Yeah, we can talk
et
about
cetera.
that if we want to. Maybe just sorry to interrupt, but if we can get through the three other guests,
Absolutely.
and then open it up at large for a little bit. The funding question gets. Robin, your point is spot on. There's a lot of stuff happening that will probably need your help in loosening up some of those purse strings. I think next was New Life Center and Rob and Neil. Thank you so much, Lisa and Dan.
Good afternoon. My name is Rob Swears. I'm the director at New Life Center, and I was told I had 5 minutes, so I'm going to make it short. No, I'm just kidding. But I don't want to presume that everyone knows what we as an organization do, so I will be very high level. We shelter single males, 18 and over, and then we feed and clothe men, women, and children from our community. So we have been in existence since 1907. We are at 1902 3rd Avenue North, North Fargo. So we have been caring for folks for a long time. And my predecessor, Dan Danielson, some of you may have known Dan, I took over as a director in 2013. I started as the assistant director in 2010. And Dan at that time had said a lot of the service providers kind of did their own thing. We each really kind of functioned as our own entity, and we don't ever want to use the language like, well, these are our people and those are your people. But what I have seen since 2013 as taking over as the director is a significant shift in our community, which is a great shift in that spectrum of being able to, as a service provider, pick up the phone and call the other shelters in the evenings. The shelter staff are talking to each other. We're using electronic communication, prevention and diversion to basically get people into shelter at an appropriate spot as quick as possible. And I think I want to just touch briefly on that as well, because those folks that we serve are not our people, but there are some folks who will be more successful, for example, at New Life Center than they would be at Churches United or at Gladys Ray. And so the importance that we have as service providers of knowing who will be successful at which location is something that we want to be very mindful of. So shelter communication, prevention and diversion, and then overflow shelter. When I started in 2010, we did not do overflow. And at that time we were using too the language of winter overflow. We weren't doing overflow. When we were full, we were full. And that shifted as the numbers of folks who need service has increased. And you are likely familiar with the church sheltering project, where different churches around the metro took a week at a time, and then we would process them at our respective locations, and we would bus people over to a particular church. Well, that was a great opportunity for us as an organization to really draw attention to the issue of homelessness in our community. And I don't use the term the problem, but the issue, right? These are folks who need help in our community. Well, when that stopped, when the Church Overflow project stopped, what happened really was the shelters were asked to shoulder that burden by and large. And it began to fade from the public eye, unfortunately. So we're talking about some of the gaps in the housing, the continuum, and just talking about prevention and diversion, overflow. And I want to make the point too that something that is so important in that continuum is shelters, because a lot of times that's where folks enter the system. That's where they may be coming to our community, they find a place, and maybe they're not able to stay in housing. And so shelters are there to receive those folks, whether they first show up here or whether they are not successful in housing. And so that safety net, I think, is extremely important. The housing continuum is not successful if we don't have a healthy shelter system, because that's often where folks start. And I would say too, where is that gap? And I'm gonna touch on it here, and I'm gonna touch on it a little bit also in the magic wand question. And that comes into, when we're talking about supportive services, but also able to address professionals who are able to address the mental health concerns of the folks that we serve. They are not bad people. These are folks who are vulnerable. And mental health concerns are definitely one of the significant issues that we see on a regular basis. I'm going to end with the magic wand question. So I'm just going to touch on how can the city of Fargo or city taxpayers best support what happens at New Life Center for our mission. I've got 4 different little things I'm going to touch on here. And the first is I would ask that we recognize and embrace the fact that these are folks who are part of our community. These are not individuals who are a subset. When they are with us, their zip code is 58102. These are individuals who are part of our community. And so how important that is to be able to embrace that. And I know that I wouldn't have the privilege of being here, and we wouldn't have the privilege of being here if that weren't something that we're already embraced. I would say on the heels of that, then with that recognition is the charge to figure out what is the city's response or our community's response in being able to support the shelters. And going back to something we talked a little bit about, which we won't dive into today, is how to fund that. We know there are some opportunities in the present time, but we'll dig into that a little bit later. I will say too, before I jump off of this point of making sure that we recognize they're part of our community, is the silver lining of coronavirus has brought us to this point. Again, being able to address this body and to be able to bring this up, and what I've seen over the few years that I've been at New Life Center, we are in a much better place. We're not done, but that public will. So I want to say thank you there. So my second point on this, how best to support our mission, is we are currently in a state of decompression. I have to say, for this short window of time, and I'm talking about the season of coronavirus here, this has been one of the things that has allowed us to have, in the crazy of busy work that we do, being able to say, you know what, there maybe is a better way for us to do this. Because one of the things that we've been able to do is we've moved Overflow offsite across the street with a partnership with the city of Fargo, being able to do that overflow offsite. And we are seeing the opportunity for our shelter guests, those who are in-house in the shelter, not in overflow, but for those men to be able to get the services. Because what would happen in the past is in the winter, we would, and not to be crass, but we would just put as many people in the building as we could. And I don't probably have to turn around and look at some of my partners here. It falls to our shoulders to manage that, but it doesn't mean that we increase case management and we increase all of our other services like security and other frontline staff. We just suck it up, and what happens then overall is the quality of service for those folks who want it goes down. And that makes sense, I think, there. Interestingly, last week, so we also are sheltering individuals who are COVID positive. So we're testing, we're sheltering them, we've got an isolation unit. Last week, we had the highest number of individuals at a single time that we've had all season. And we know that flows and ebbs, but again, that sense of if we discontinue overflow, those folks are going to come back into the shelter and that recompression is going to happen again. My third point, I touched a little bit on it here, is overflow, and I would ask that we figure out how to fund overflow as a community. Because that goes back to our point of being able to get the services to those who need it and want it. Because not everyone, and I think it was touched on a little bit ago, not everyone chooses to even receive that level of case management. Well, for those who want it, we want to be able to provide it. And then the fourth thing I want to touch on here before I jump off of this point is we are going to come out of coronavirus at some point, aren't we? We are going to, it's going to look different, but then I would ask that we figure out also from a community standpoint how to fund basic needs in shelters. Community and city funding has decreased or completely all dried up. But yet, the needs of individuals, in our case, those single males, continue. And as dollars from the community are shifted to other segments of the population, we need to, and we are going to continue to hire case managers, provide safety, and we will continue to fundraise to offset that. But again, to recognize that this is certainly a community concern. And lastly, and I'll be brief here, what is the magic wand? The big thing for us, yes, we want more housing and we're working on those things with our community partners. But then when people get into housing, that they would be able to stay there. And often those supportive services and those mental health services, not everyone is going to be successful in housing. It's just not going to happen. But are there other supportive services, especially surrounding mental health concerns and issues that we can embrace? And I would love to be able to say with a magic wand, and I wish I had one, that we would not actually need overflow, but we're not at that point today. Any questions for me or for us? Neil Hines is our program director. I'm the one who does all the talking, as you can tell. So if you got any questions for us, or we'll pass along to the next group as well.
I'd be curious about vetting people. Do you pay attention to, and this might be more general, but like if somebody's been incarcerated in the past or is just coming out of incarceration and is lost for housing or situations of that nature?
Yeah, we certainly, not as far as necessarily, there are some criteria for shelter. Now, are you talking about to receive our services or to get into housing?
To get into both.
Not real exclusive as far as being able to receive services for shelter, because we want to be able to extend those as much as possible. When we get into the arena of registered sex offenders, and that's a segment of the population that's increasing, we certainly are asking questions there, and we want to be mindful because it goes back again to a safety issue, safety concern. But otherwise, violent felonies within a certain period of time, those are individuals that we want to find that out. And a lot of times too, when someone is coming to our front door looking for shelter or calling in somewhere else, again, this doesn't mean that we want to separate the behavior from the person. A lot of those things, what they're going to say are survival instincts. I'm going to say what I need to be able to get off the street. And so we often don't find those things out right away.
Tim?
Correct me if I misunderstood. When you were talking about having the overflow across the street and that was a new process, and you said that changed things for the better overall, is that what I understood? Is there a takeaway from that experience that the rest of us can learn in other, not just for New Life Center, but what is it that the rest of us can learn from that might be applicable otherwise?
I know I've got something, and Neil, if you've got anything else, but I think one of the things there is we just didn't even realize that we could think a different way about what we were doing, because what happened so much is we got into survival mode, and to be able to step back and say, hey, we can do this. We can partner with the city of Fargo. We can partner with others. And our dining services are bringing food over there. We've got a separate crew for managing the desk and overnight security. And all of a sudden, we don't need to function in that survival mode anymore. That was one of the big things for me anyway. I don't know if you've got anything additional, Neil?
Yeah, and I think, too, the proximity of people, obviously, when we're doing internal overflow, you've got a lot of people already in the shelter, and then you're adding probably a third again, what our normal census is. And so you've got cabin fever because a lot of these folks are camping out or doing other things during the summertime, and they're cooped up, and it's 20 below zero. Fortunately, not this year, but in years past, for weeks on end. And what happens is, it's miserable for everyone, and so they're kind of on top of each other. And the instance of law enforcement having to come and deal with some folks that are acting out, and that goes way up. And so this year what we've noticed is there was a lot less of that, and people had more space. They weren't on top of each other, and so that helped a lot. It also, for quality of life for people that are stuck in that situation, they have an option just to boogie out of there when it's cold and blizzarding out. They can't get away from those situations. And if you're dealing with mental health, a lot of times the last thing you want is somebody in your face annoying you or doing something that's going to set you off. And so having that ability to kind of just spread people out a bit so they're not all cloistered together was a huge success for us, and something that we've not experienced before. So having that this year, we were really appreciative of that.
I'm just curious, is there a clearinghouse hotline for people to call and say, hey, this person needs services, rather than calling the New Life Center or calling Gladys Ray or calling Churches Unite? How do people in the community generally approach the topic to begin to get services directed at somebody they know?
Yeah, so 211 and where our community is working on it. Obviously, we started with prevention services the most, but moving towards shelter as well. There's a plan in place so that, and you're used to calling 911 if you've got an emergency. Well, 211 is going to be that housing emergency. And there's folks here that can speak better to that than myself. But yeah, so to answer your question, yes, that is something that we've been working on and continuing to improve. And also, you know, the shelters amongst each other, we share a list. So if somebody's looking to access shelter, we share those lists so that if someone calls Churches United, they get on the list. If there's a bed at Gladys or New Life Center, we can call them for shelter. So they don't have to keep calling around looking for a bed.
Maybe this is directed at Nicole, but at some point I would like to know if there's some industry standards for caseloads, because what I heard was you just kept on stuffing more people and you didn't hire any more. And so there has to be some type of standards, and I'm seeing Thomas nod too. To say we need more staff is one thing, but to pinpoint how many we should have is much easier to ask for funding and grants and fundraising.
Yeah, I wouldn't say I'm an expert by any means, and but I maybe go back to Rob. I know when during the pandemic, that was the weekly conversation of, yeah, we can add services, but how are we going to staff it? And I know, Rob, you've been depending on temporary employees or I lost the word I'm looking for.
Temp agency employees.
Temp agencies, thank you.
Yeah.
But the training and so it's really hard to like just start a program. I know at Churches United, we had to commit a level of funding so that they could actually hire staff and support that work, because you know, if the temperature fluctuates, you can't just close shop and then fire those people and then rehire, you know, so it becomes a whole operational discussion. And I know Jan and Leah can talk to that as well. So.
Thank you.
Yeah, and we'll hand off here, but I will say too, one of the blessings that we have in our community is relatively low unemployment. One of the challenges that we have as a nonprofit is we are trying to squeeze a dime to get as much out of it as we can. So our wages often are not as competitive as maybe they are in other sectors. And you can add 2 and 2 together there. That often results in folks who maybe are not equipped or really want to be working in a shelter environment. So thank you.
Anybody else? Neil and Rob, before you leave? Okay, great information. Thank you.
So next, thank you so much, Rob and Neil. Next, we have the Gladys Ray team, or the harms reduction team, Jan and Leah, that probably don't need any introduction to this group.
Hi. 13 years ago, the Gladys Ray Shelter opened, 13 years ago last month. And boy, have we learned a lot in that time. We've learned a lot about what works, what doesn't work, right? We've learned about what we needed to change in our community. Things have definitely improved, but we still have a good ways to go in order to truly address homelessness, especially long-term or repeated homelessness in our community. So like everyone that's been up here, I would say finding adequate supports for people once they move into housing. We opened 13 years ago, and we are still today serving people that we served years and years ago. Not because we haven't gotten them housed. They've been housed. They haven't been able to stay housed. And part of that has been we just simply haven't had what we needed as a community in terms of resources to make sure people stay housed, or at least increase their chances the best we can. So sometimes that's intensive case management. We have some of those programs going now. We're seeing people do much better than they've ever done, no doubt. However, you know, our mobile outreach team, they were trying to increase services there, or at least increase the availability of that service so that they can go into homes, just check on people, see if people are doing okay, see if people have company over that don't have their best interests in mind. You talked about exploitation. Our staff can pop in and just make sure that everything's going okay in an apartment, see if they have to, if there's anything they can do to help somebody get their guests to leave who have maybe been there for too long, make sure people are just taking care of their most basic needs, whether it be their health and their bills and all of those types of things. Housing is incredibly isolating and it's incredibly lonely. So that would be the very first piece that as a community we have to figure out. Currently, we don't have a lot of resources for helping people kind of learn how to live before they end up in housing. As soon as we know that somebody's headed there, let's start working on helping them build up some of that social equity, helping them build new connections in the community that can, when you think about all the connections that we all have in the community in which we live, folks that have been homeless for a really long time are often only connected to other people that have been homeless or that may be living in crisis or are still homeless and would like someplace to stay. There's just so many things that are so complicated about moving into housing. Just like homelessness, every single situation is so different, and how that intersects in terms of personal and political and social aspects it's unique for each individual, just as moving into housing and being able to keep that housing is unique for each individual. Some may choose to be involved with intensive case management. Some may choose to just, some may feel like they'll do okay just with the Gladys Ray staff popping over or whoever else can pop over and talk with them. And some might need to be housed 15 times before it finally works because it might take that many times to learn enough about the challenges that they face and what works for them to really truly do well and stay housed. So supportive services, when we're talking about what do supportive services look like for somebody who's in housing, it's all of those things. It's being able to stay connected to other people, to deal with the loneliness and the isolation that comes with housing, especially when you've lived in congregate settings like we've been talking about. Housing can be like, it can be so quiet that it's deafening, right? It's because of the life that people lived for so long before that. The engagement center that we're trying to get going downtown, I think that'll help too, because again, it provides another social outlet for folks. It's a place we can help people. Maybe we can offer services where other people who have already been there, done that, people with lived experience can help people newly housed or moving toward that, learn about what works and what doesn't, and some different things that they've learned to get through that. Ultimately, the goal for us is housing, right? It's, the goal for us with the Gladys Ray is to maybe not have so many beds at the Gladys Ray anymore, right? The Gladys Ray shelter was started so that we can make sure people who didn't have any other options in the community had a place to go. And I believe we're doing the kind of work now in our community that we need to do so that we don't need 35 beds at the Gladys Ray. There shouldn't be a need for that many beds for people who can't be served elsewhere. And in the meantime, we also want people to not have to access shelter at all if they don't want to. Those folks who might be, that's why, the engagement center model is something we're really pushing, because we believe that people unsheltered or sheltered, doubled up at somebody's house or sleeping outside, all of those folks need that one place that they can go to get connected to the services that they want to be connected to, and hopefully figure out what their goals are for housing and how to get there without having to necessarily access the system that they've had to in the past. So I think that, and Leah can speak much more to housing than I can. Leah's our housing rock star, and she's really, really hung in there with people in a way that just amazes me to help folks get access to housing, and then try to figure out how do we keep those folks housed. Again, if everybody that we were able to get housed stayed housed, or even 75% of them, we would already be without a need for 35 beds at the Gladys Ray shelter. So a couple of things, if I could wave a magic wand, it'd be continuing to build on the engagement center model downtown that serves the entire community. It gives everybody in the community an option to, for example, if you were to come across somebody who you thought was really in need, could possibly be homeless, could possibly have some challenges related to mental health, I've heard that come up a lot, that would be a place for them to go where they could get the type of services if they so choose, or just connect, do laundry, take a shower, connect with services, and see what, when people can just calm down and set their stuff down for a minute and figure out what do they want and what do they need right now, a lot better conversations take place. The other piece that we would have, if I could wave a magic wand, would be real-time data. I think that it's really, we do point-in-time counts, which is a count that we do in the winter. Currently, it feels like the data that we have, and hopefully maybe you guys agree with me. Currently, the data that we have helps us describe our population of people that are homeless, but it doesn't help us necessarily achieve anything right now today. If you could take a look at, this is how many people are homeless today in our community, and this is how many apartments we have available within our continuum and so on, you could really see, man, we have some work to do, or this is where the gaps are, this is where we're doing really well. Everybody in our community should have access to the information to help you understand what really are we talking about when it comes to homelessness in our community. The other and final piece for waving a magic wand for me would be really finding support and getting some momentum around addressing the issues of systemic racism when it comes to homelessness. You cannot end homelessness. You cannot truly and effectively address long-term homelessness without addressing the issue of racism. We have a lot of injustices around race and ethnicity, and being able to identify the disparities and talk about those, I think, is a pretty big deal. Part of that is if we had all the housing we wanted today, if all of us had whatever we're waving our magic wand at, unfortunately, we'd be filling all of that housing disproportionately with people of color. And we have to start figuring out what's going on there. And in many cases, we know. But we have to start being able to address those things if we're truly going to address the issue of access to housing. Housing is a human right. How do we end chronic and long-term homelessness? How do we provide better services for folks? We have to be able to deal with the awkward and uncomfortable issue of racism, because it definitely perpetuates and deeply embeds homelessness within our community. That's proven. It's not a matter of opinion.
All right. I never want to talk after Jan. You know, everybody has talked about what COVID has done or did do for some things. One of the things that it helped with us was there was a particular voucher that came out for housing last year. And with that voucher, we were able to house over 40 people from the shelter, which is the most we have ever done before. The issue that we then had was, I have all these people in housing and there's no way to keep them there. We don't have the people to go and check in on them all the time. Staff, as John was saying, we do what we can to have our mobile outreach program go out there. We're another one now too. But we still are running into things, just little things, like somebody turning in their pay stub. If they don't do that and their rent fluctuates all over the place, then they end up losing housing because they can't pay for that. Luckily, Sarah and others have been able to help with a lot of that and keeping these people housed. But that was one of the biggest things. I know we did do a collaboration, the City of Fargo and Presentation Partners, which has allowed us to get more intensive case management, housing navigation into some of our people. And we have 2 dedicated navigators now that we're trying to get connected with people that I had housed already, but they're struggling. We started with the most recent ones who had the most issues with landlords and things like that. And we continue to go down the line. Really trying to, the biggest thing is finding that supportive service. We have another gentleman who's been sleeping outside. He was housed at one point, lost his housing, sleeping on the Minnesota side of the river right now. And I just yesterday got an email that we got him connected to a supportive service in, with Summit Guidance. And Gina at Clay County is helping us get him a voucher so he can get housed again. It's having those supportive services. That was just a random fluke. I sent an email and it happened. These things do not happen on the daily basis, and that is what we really need, are those supports for people when they are in housing. So my magic wand is just more affordable housing, period, because we've got people sitting in the shelter, and I'm looking at the different programs like Cass County Housing Authority over in West Fargo. They have some vouchers right now, but the limitations on criminal activity, I can't get anybody a voucher over there, or certain people. So being able to get the vouchers or having some kind of assistance for housing for people is huge, especially if they do have those criminal things. We have a female that, and I just really go off of my examples of the people that I'm working with because I think it has a big impact. One of the females that we're working with, she got, she had 2 felony charges, a burglary and a possession charge. Just about a year and a half ago, she got pregnant. She now has her baby. She has been clean. We have been trying to get her housed. We can't find a landlord that will house her. So finding things like that, she is doing so good. She's done everything she needs to do, and she's still sitting in a shelter situation with her 5-month-old baby. So I'm just all about finding whatever we can to get our people into housing that they can afford and the supports that they need, because they're not going to be able to stay there if we don't have the supports in place. I don't know, do I need to say more?
You did great.
Questions?
Oh, sorry.
Oh, I just had questions.
Did I miss something? Was, Nicole, were you pointing at somebody or?
No, I was
Oh.
just going to see if anyone had questions.
Oh, good. We're on the same page.
I can babble on and on like Jan, so.
Well, part of it is that this information is landing like a lead balloon. It's very heavy, solid, serious information. You know, I need to process it, a lot of what you're saying, but it's all over the board as far as our needs, but it's so enlightening that you're sharing this with us in a candid, honest way. I have
When
a
I
question.
didn't start crying, I usually do.
I have
I'm proud.
I have a question, just in a sense, and then I know we need to move on with the agenda, but I'll never forget March of, I think, 1998, maybe 99, when Columbia White Lightning died in town. And I think that was a turning point in Fargo, in our broader community, is my sense. My question is this, I don't recall very many deaths. I know a year or so, there was somebody found in town under a truck, but, you know, Grand Forks has had 2 or 3 to R1 deaths of people found in the communities. You're doing if that's one of our measures, we've done a remarkable job keeping people from dying out there.
You know, it's prior to the Gladys Ray opening, I know that we had, you know, people freezing to death in our community every winter, typically because of, you know, issues with substance use and some other things that just really prevented them from accessing some of the programs in town. And, you know, since we opened, we certainly haven't seen that happen as much. We've actually had it happen a couple of times down the street from the Gladys Ray, and we know in both cases that those folks were trying to get to us and didn't make it. I think the most important part of it, though, is that while people froze to death before because there wasn't a place that could serve folks who were under the influence or having some of those challenges, the difference now is that nobody dies because of that. Nobody dies because we refuse to have a place for those folks to go, or that we aren't able to provide a place for those folks to go. So I think that that's an important component to it, yes. And I think that does speak to our community. It certainly speaks to the city of Fargo for being willing to take that on. At the time, I'm always amazed by that because it wasn't a popular decision, but it was a really important decision.
Anybody else with this presentation? Any feedback?
How many mobile outreach members do you currently have? And if you had to put a number on how many you need, how many would you need to go in and provide those services?
How many mobile outreach, what? I'm sorry.
How many people do you have currently that go in and help people stay housed? And how many do you think you would need?
Well, we currently have a mobile outreach team that operates essentially about 16 hours a day. I guess it's a little bit more than that.
9 to midnight.
And so they operate throughout the day and into the evening. That program is funded currently by the state. We're looking for some sustainable funding there, but the idea is to respond to any crisis that involves substance use. And that could be somebody in housing, that can be somebody that's homeless, it can be any situation. And we've been able to avert a much more costly response to that. And typically it's law enforcement, ambulance, fire department, all of these other things that happen in order to make sure that somebody's basic needs are met if they are in that crisis. Those folks answer calls from the police, from emergency departments and detox units, a number of different places, so they can be really, really busy. When they're not doing that, that's when they do that outreach and go do some visits into people's homes. So they're not able to dedicate all of their time because we have to meet the terms of that contract, which is to be responding to all those other calls too. We did currently get a little bit of funding so that we could add a few hours to that. So, I mean, we still don't really have a lot of dedicated time to go into homes. I don't know how many home visits we're doing on any given week. It depends on how busy the city is on any given week with emergencies related to substance use. But they're seeing people at least every single day. They are going out and seeing at least a couple of folks. Sometimes it's way more than that if it's a quiet day in the community.
Jan, the mobile outreach unit concept, best I can tell, isn't a common thing around the country, is it? Or is it getting more common now?
I think it's getting more common in the sense that, you know, there are mobile outreach teams that, especially in the homeless service arena, that are, you know, might have a case manager and a medical team and so on, where they're really trying to get out in communities where they have a lot more folks who might be sleeping outside or just a more congested areas that weren't intended for human habitation. So in terms of actually having teams that go out to try to meet any crisis related to substance use so that police don't have to, and ambulance and fire don't have to, and we can avoid jail stays and inappropriate emergency room visits and all of that, it's been a pretty unique program. It has become, I think that we're starting to see a few more, but it's pretty unique to this state, or to this community, I should say. We're the only one in the state.
Could I interrupt? I am reminded that the library board meets at 4:00. So we have a little scheduling gap. And so we would like to make sure presentation partners, thank you so much, Jan and Leah. And we'd like to invite Sarah Kennedy with the presentation partners.
I'm a fast talker. Good afternoon. My name is Sarah Kennedy, and I'm the Homeless Prevention and Diversion Program Manager at Presentation Partners in Housing. So I'm kind of a horse of a different color than the housing providers and shelter staff here, but work in conjunction with them. So when I talk about homeless prevention and diversion, I'm really talking about being the front door entrance into the homeless response system. And our team is working diligently on trying to slow the inflow of people coming into the system. And so when I talk about prevention, I'm talking about preserving an existing housing experience. So if it's safe and appropriate for somebody to stay in their housing, we do whatever it takes to try to keep them in housing. We have targeted prevention to target those who are most imminent risk of losing their housing, but then also to work with individuals and families who are currently experiencing homelessness already. We are shifting, having this paradigm shift to be, to take on more diversion, so that when individuals are experiencing homelessness, we've employed a team through the City of Fargo and the United Way, additional funds to hire housing stability specialists, which to me is just a fancy name for professional problem solvers. So anybody in our community experiencing a housing crisis that could lead to homelessness or is currently experiencing homelessness can call First Link 211. We've partnered with them. This just started in January, so it's a relatively new program, and get connected to one of our housing stability specialists to do a very guided screening to assess exactly what's going on in the household, where did things go off the rails, what strengths do they have, what is their plan going forward, how can we best support them. A lot of times you have to pay to stay, and so we have to help with rent, we have to help with utilities and security deposits, but not everybody needs those supports. And certainly we are not we're trying to avoid being a community ATM. We want to get the right resources to the right people at the right time. And as my colleagues have indicated, mitigating that immediate housing crisis and then wrapping around the additional housing supports that are needed to keep them in housing is so important. So our team is laser focused on ending homelessness by preventing it in the first place. And to give you an example of of a real life example, I think it was mid-November when Nicole approached Presentation Partners in Housing and Senca, one of our partner agencies, to see if we could basically overnight enact an emergency rent assistance program with some of the CARES dollars that were becoming available. And within 2 months, we allocated $1.6 million to help 2,836 individuals stay in their homes. These are families who are vulnerable, who had gone months without being able to pay rent, perhaps because of the virus. And I can say in the 4 months since that program has ended, less than 1% of those households have come back with a new housing crisis, needing more support. So we do feel like if we can catch people and try to keep them out of the homeless realm of services, because we know the longer and more often somebody experiences homelessness, the better they get at being homeless, and it's harder to get out of that. Thinking about gaps and Magic Wand sort of somehow are the same category in my mind. Historically, the gaps have always been just having enough resources, but particularly at this critical time, having enough staff and financial resources at the front door to help as many households as possible. So a year ago, or before COVID, it was typical for our programs to receive over 100 requests for assistance each week. And it was an awful process to try to figure out how do we prioritize which households, who should get the assistance, who do we care more about, it seemed like every time we had to make those decisions, it was major heartburn time because we couldn't help very many. Lucky if we could do 15%. Since that time, and with the rise of all these new CARES and COVID dollars through HUD, FEMA, wherever they come from, we are now seeing 122 housing crisis contacts each month. So we've completely flipped that, which has always been our goal. Things like the stimulus, all the measures that are being taken to help low-income families who shouldn't be clogging the emergency shelters. 84% of the time we're able to prevent or divert people from homelessness. And we have, our long-term goal is to open up a housing crisis line where when people are needing shelter, we would be the ones receiving that call first and foremost, and try everything in our power to connect them to other safe alternatives that isn't just immediate to the shelter. Not that there's anything wrong with the shelters, they're incredible and do amazing work, and we're always gonna need shelter. But if we can kind of unclog the drain and not have so much demand, if we're successful on the front end at the front door, there should be a ripple effect that provides some relief down the road for New Life Center and Gladys Ray Shelter. And so that's what we're aiming to achieve. 46% of shelter guests in 2019 entered shelter immediately after losing their housing. That's a huge number. That's 1,185 people that if our team had an opportunity to meet with, I'm confident that at least, even if half of those could have been prevented or diverted from having to go to the emergency shelter in order to get connected to resources. I mean, that would be a game changer. The magic wand question for me is to have more flexible funding so that we can do diversion. All the federal funding in the world is great, and I'm never going to turn it down, but there are restrictions to how it can be spent, and it's rent, deposit, and utilities. But our team of problem solvers needs the flexibility to be creative. It might take putting somebody up in a hotel for a couple of nights when they're experiencing homelessness, just to buy enough time for our team to put together a housing plan to get them into new housing, to wrap around the supports they need to stay in housing. It might take, we might need for diversion a family to double up with other friends or families, coworkers, whoever might be able to give them a place to stay for a short time. And because of the increased food cost, it'd be nice to be able to give them a gift card to Hornbachers, for example. And those kind of investments are so much cheaper than the real costs that are associated with experiencing homelessness economically and mentally. In addition to flexible funding, just with the federal funds we receive, we're limited in the households that have already proven that they're vulnerable, already have a history of homelessness, have comorbidity, trimorbidity issues that they're battling, and they fall behind on rent and they have subsidized housing. Our federal funding will not allow us to help in that case. And it's really awful to see somebody come through. They've already experienced everything they have housing now, they have a voucher that subsidizes their rent, and they're at risk of losing that housing for a minimal amount of rent assistance. And so having unrestricted dollars would be extremely helpful to help in those situations. Again, I'll just echo what my colleague said about support services. It's great to prevent the loss of housing, but what will it take for them to maintain housing for the long term? I think one of the last questions Nicole posed to us is, what do you need from the city of Fargo? I spent a long time thinking about this answer, and first and foremost, I think it's just to believe that homelessness is solvable. I feel like for the first time in my 16-year career, we are better positioned now than we've ever been. We know what it takes. It's just filling those gaps. It's making sure that we're resourced up, that we're staffed up, that that our data is being collected and informs our practice and tells us what we need to do and how we need to do it, and working with the people who are receiving our services to guide our practice always. So I appreciate being invited here today, that this is even a topic that's being discussed. Please continue to believe that homelessness is solvable, because it is. That's it.
I saved the best for last. I think we can all agree. We're so proud of the Presentation Partner Program and United Way support, and the vision that all of these leaders have in our community. As you can tell, the city of Fargo is just, the reason this slide is here is it's really easy to talk about homelessness and housing, and when talking about high level, it's hard to get into the weeds and into the details. And so as these guests have shown us, It's really important to get into the weeds and the details to solve the problem. And so these are all, the slide shows all the programs that we're currently supporting and funding right now and our partners. These are just 4 of them. And, but they're all instrumental. And so with that, I'm sure you have questions for Sarah, and we can also schedule, and there's more of these types of conversations to happen. This is just introductory for today.
Yes, Tom?
I was wondering, it kind of actually started with Jan's comments on the mobile outreach teams, but I think for folks on this committee and listening, could you talk about the cost savings from like reducing social services when you keep people housed? Because I think if you're not a human-centered person who doesn't care about people, which again, maybe there are some, hopefully you should care about economics. And again, I think that's a really important argument to make, that what you guys are demonstrating as a collective group, it's not just you, but everybody, that housing's a cheaper solution. I know they've done studies about that too, but just wondering if you can touch on some of the cost savings that you guys see.
Yeah, and I don't have the numbers in front of me, but so our housing navigation program at Presentation Partners in Housing works with some of the, works with chronic long-term homeless people with the most housing barriers, the most issues to overcome in getting and maintaining housing. And what we have done, this program's 4 or 5 years old now, we collect records on how many emergency service utilization programs or units they've had to use prior to getting into housing. So number of nights in jail, number of nights in detox, emergency shelters, number of ambulance rides. What am I forgetting? ER, trips to the ER. So very costly, taxpayer-funded emergency services, just things you experience when you're homeless. And so we calculated the number of those units, and then compared it as people were getting into housing longer than 6 months, 1 year, 2 years, 3 years. I think we're coming up on 4 years now of individuals being in housing with intensive housing case management support. And each year it is increasing. Of course, the number of individuals we're being able to take on and house is increasing, but it's saving millions of dollars. Do you happen to have the right numbers? So my colleague Beth is the one who runs this program. I texted it I can look on my phone if you want the exact dollars, but.
Well, and I think we are running out of time. I know the library board's probably
Email it to the
anxious
committee.
to start.
Did I answer your question?
Yeah, but just email it to the committee. I think that, again,
Okay.
it's just really important for people to understand that those are real dollars in this community that are being saved because of
Yeah,
what
and the
all of you are
question I
doing.
think Robin asked about caseload, our team, I mean, it's very intensive case management. Typical caseload for them is 15, and we know that we could have 100 more housing navigators.
Really quick, Nicole, John. What I'm hearing, great services. Thank you. You guys are helping with the symptom. But back to Jan's point and what you just said, if we have the data, we would have the ROI. And Tom and I are nonprofit leaders, and so that would be a strategic model for the long term that I'm very interested in supporting or looking into.
Nicole, I'll turn it back to you for a moment.
Yeah, and I guess just because I filled out a grant application last night at 9 o'clock for some federal things, and I calculated based on the math that Sarah had, I did a quick calculation of $23,000 per night per person of people served that we're saving. Or that's what it costs if they're not addressed through the mobile outreach program.
Anything else for the good of the order? The people who've been presenting to us today represent the unsung, too often unacknowledged heroes in our community. The people who are on a daily basis saving lives and protecting families and individuals' dignity. So the work you do is just beyond measure important. And thank you so much for being the messengers of hope and the deliverers of services to people in need. I suspect our committee, and Nicole, we can work further. This is a topic we're going to continue diving into. This is a topic front and center for us. There's many aspects of it for us to continue focusing on, but it's a start, a new start. Post-COVID, we can reinvent the way we do business, and we can learn from what we've all been through and glean the knowledge you have and get that magic wand out, change hearts, change minds, and change budgets. Anything else, Nicole, thank you all very sincerely. Thanks to the members who participated. We'll at least be meeting quarterly, so you can kind of expect that. We've pulled back our schedule to a quarterly schedule right now. Laura and Chris, thank you and Mark Puppy, the new members of the committee, thank you all for being here. And on that note, we'll turn it over to the library board so they can start hopefully at 4. We stand adjourned.